Hi, I'm Jesse. Today we're going to be doing patient skill 28. Patient skill 28 is ambulating with the Lofstrand crutches in a 2-point and a 4-point gait pattern, turning around and then sitting in a wheelchair. So the first thing we're going to be learning about is the 4-point gait pattern. In the 4-point gait pattern, you'll have a patient that's in a partial weight bearing of the lower extremities. Some of the things that you need to consider is, does the patient have enough upper body strength to withstand the Lofstrand crutches? They also have to have a lot of core stability because there's no axillary bar, like in axillary crutches, to assist them from side to side. As well as during this, you will have 3 points of contact on the ground at all times. So it's a slower but more stable gait pattern than the 2-point gait. Okay, I'll stop there. So for this, we're going to be moving the right crutch forward a stride length, and then followed by the left foot to the even level of the opposite crutch. And then you're going to be moving the left crutch and the right foot, and then just continue this gait pattern. Okay. So for the 2-point gait pattern now, you're also going to have a patient that's partial weight bearing, except for they've already had practice in the 4-point gait, so you're going to be progressing them forwards to a 2-point gait, which you would need increased upper body strength, increased coordination, and then just being familiar with the crutches. For the 2-point gait pattern, we're going to have 2 points of contact at any given time during the movement. And what I mean by this is we will have 1 point of contact with the right crutch, and then the left foot, lower extremity, will have contact. So we're going to continue that pattern of moving right crutch with the left foot a stride's length, left crutch with the right lower extremity, and just continue this pattern. Okay, so we're going to be going over just some of the instructions that we're going to be giving our patient, as well as the positioning of the therapist during the 2-point gait pattern. So the first thing we want to do is have the patient's feet with a wide base of support, so that would be just outside of the ASISs on either side, as well as the crutches need to be just anterior and lateral to the 5th metatarsal. So Johnny, going over base of support for you, we just want you to have a wider base of support there, and then if you can have your crutches just outside your little toe, that'd be awesome. And then from here, we want to make sure that our gait belt's on first off. We have a clear path for them to ambulate through. And then for positioning of the therapist, you're going to be wanting one hand supinated in the gait belt, as well as your right hand just anterior to the shoulder. And you want to be on the affected side, or the weaker side, which I've depicted here by the bandages. So as we ambulate forward, you're going to be giving yourself a wide base of support. So you're going to be wanting your lead foot going forward along with their crutch. So as they move their crutch forward, you're going to be moving your leg forward. And then the back foot will be turned at a 90-degree angle from that, just to give you a good base of support. So for this, we're going to start ambulating forward, and I'm going to explain to Johnny how to do that. Okay, Johnny, so we're going to be going into the 2-point gait pattern. For this, we're going to be moving your left leg with the right crutch at the same time, about a step's length forward. So we'll do that, and then you follow the same pattern the other way. And then as we get up to the chair, we're going to do a nice wide turn. Does that sound good to you?
Sounds great.
All right, so whenever you're ready, go ahead and right crutch forward. Okay, there we go. Okay, now go ahead, start turning. Keep the same gait pattern you have going.
Okay.
Okay, now we're just going to back up until you feel the chair behind you, the wheelchair behind you. So the same thing going backwards. Okay. Okay, now that we're in this position, we're going to properly instruct the patient on how to sit down in the wheelchair. So first off, we want to make sure that the wheelchair is locked. And the whole time we're doing this, we want to make sure we're keeping contact with the patient on the gait belt. There. So from here, we'll give instructions on how to sit down properly. So Johnny, if I could have you, we're going to take the crutches off, and we're going to place them on your left side, since it's the unaffected side. So if you can, we'll get those off. And then put both of your bars together, like that. And then you'll use that as support, as well as you're going to reach back with your opposite hand towards the rail in the wheelchair. And then as you sit down, slow and controlled, you're just going to kick that foot forward so your legs staying straight, okay? So go ahead, nice and slow. Okay. And that's how you properly sit down in a wheelchair. And refer to skills 27 to stand up in the wheelchair, as well as fit yourself for the crutches.